Defending Care Episode 5. The Bill That Will Close Nursing Homes. In June of 2025, researchers at Brown University School of Public Health published a list. 579 nursing homes named, located, identified as being at elevated risk of closure. Not at risk because of poor management, not at risk because of low quality, at risk because of a bill moving through the United States Congress. 66 facilities in Texas, 51 in Ohio, 39 in Missouri. Inside each of those facilities, residents, staff, families, the accumulated institutional knowledge of years of care. In July 2025, the bill passed. Medicaid is not a program for the very poor only. It is the backbone of American long-term care. Medicaid pays for approximately 60% of all nursing home residents in the United States. It is the largest single source of funding for long-term care services, more than $207 billion annually. 60%. Not the majority of funding, the majority of residents. The people in America's nursing homes are overwhelmingly there because of Medicaid makes it possible. Without Medicaid, most of them have nowhere to go. Medicaid also funds home and community-based care. The alternative to a nursing home, the thing most people want. Medicaid's home care programs help approximately 4.5 million chronically ill or elderly people stay in their homes. The national median cost of home care in 2024 exceeded $75,000 per year. 4.5 million people staying at home because Medicaid pays for someone to help them bathe, to help them eat, to help them remain in the place they have lived for 40 years. These are the people who do not want to be in a facility. Who are managing? Who are keeping their independence with some assistance? Here is the structural distinction that most people do not know. Under Medicaid rules, nursing home stays are mandatory coverage. If you are eligible for Medicaid and you need a nursing home, Medicaid must cover it. Home care is optional. States are not required to cover it. They choose to, when budgets are sufficient. When budgets compress, optional things go first. 4.5 million people currently staying at home with Medicaid support are optional. In July 2025, the United States Congress passed a Budget Reconciliation Act. The One Big Beautiful Bill Act cut Medicaid by reducing retroactive eligibility from 90 to 30 days, capping provider tax rates from 6% to 3.5%, adding work requirements for adults up to age 65, and increasing the frequency of eligibility checks. Projected to reduce Medicaid spending by $911 billion over 10 years. $911 billion over 10 years. From the program that funds 60% of America's nursing home residents. Now let me explain what these provisions actually do to a care facility. The provider tax. States use provider taxes to draw additional federal Medicaid funding. They tax nursing homes. They use that revenue to draw federal matching funds. Those matching funds go back to the nursing homes as higher Medicaid payments. The cap on the provider tax cuts the federal matching funds, which cuts the payment back to the facility, which compresses the margin, which is already close to zero for facilities serving primarily Medicaid residents. The 579 facilities on the Brown University list are the ones closest to the zero. The work requirements deserve a moment. Adults up to age 65 must demonstrate work activity to maintain Medicaid eligibility. The average age of a nursing home resident in the United States is 82 years. But the families and caregivers who might otherwise qualify for Medicaid support while caring for those residents at home, many of them are under 65. Many of them have left jobs to provide care. Work requirements applied to unpaid caregivers are a barrier to the very people already doing the work the system cannot afford to pay for. In March of 2025, the current administration abolished the Administration for Community Living, the federal agency that coordinated support for non-institutionalized seniors and people with disabilities. Fall prevention, elder abuse programs, disease prevention, health promotion. Its responsibilities were spread across various agencies, with staffing cuts looming in an environment of budget compression. No one is certain what will remain. Here is the logic that makes this more than a budget argument. When home care funding is cut, people who are managing at home with some assistance can no longer manage at home. They need institutional care, which Medicaid must cover. Because nursing home stays are mandatory. Cutting home care does not save Medicaid money. It moves people from a less expensive setting to a more expensive one. Medicaid spends approximately $47,000 per year for a long-term nursing home stay. Community-based home care costs approximately $36,000 per year. The home care saving creates a nursing home cost into a nursing home system that is already closing facilities. That lost 774 facilities in 4 years, where 579 more are now specifically identified at risk. We are routing more people into a system with fewer beds on a system that cannot sustain its current load, while simultaneously cutting the funding that keeps it alive. This is not incremental pressure on a fragile system. This is structural acceleration of a collapse already underway. In episode 3 of this series, I described the German collapse as a structural failure. The economics made it inevitable, not a policy choice, a structural outcome. What is happening in the United States is something different. It's a policy choice to accelerate a structural failure that was already underway. 774 American nursing facilities closed between 2020 and 2024. Before any of these cuts, the care drain was operating. The economic drain was compressing margins. The talent drain was removing the best caregiver. The stability drain was closing facilities. The policy response to that reality is to remove $911 billion from the program that kept the remaining facilities open. I want to be exact about what this is. This is not a critique of political system. The care drain operated under every administration that preceded the current one and even before. This is a structural observation. When a system is failing and the policy response is to reduce the architecture that was holding it up, the failure accelerates. 579 facilities identified, named, real. In the next episode, I want to examine the arithmetic of the only response that is proportionate to this scale. Because the arithmetic is more helpful than the news. Full transcript, citations, and the care manifesto are available at anandchaturvedi.com. I am Anand Chaturvedi. This is Defending Care.